Good morning. This is a video I have made for telling about Nasha Mukth Abhiyaan. Nasha Mukth Abhiyaan is a very good program. In fact, we are very happy to be a part of Nasha Mukht Abhiyan from Dr. A.V. Baliga Memorial Hospital, Udupi. We have joined with the District Administration, Udupi, and Women and Child Welfare Department of Udupi District and District Disabled Welfare Officer, Udupi District, and District Health and Family Welfare Officer. And we have started, we in fact are we have just completed a 10-day de-addiction camp where patients who were addicted to alcohol, tobacco, cannabis were admitted in the hospital. 51 patients were admitted in the hospital, and in that 49 people stayed back till the end of 10 days. We had to discharge in between two patients, and of course, initially also during screening, we had to reject around four patients because of their ill health. So now coming to what is this camp? This camp is a comprehensive treatment approach for alcohol, drugs, and tobacco. In fact, alcohol and tobacco, these are what is called as the gateway drugs. And in fact, we have admitted these patients, and they were here for 10 days. And during these 10 days, they were screened for different diseases which can be caused by these drugs. In fact, we used a comprehensive screening from complete blood picture, liver functions, kidney functions, and wherever needed, thyroid functions, serum amylase. These were the things which we screened, and wherever the results were very high, which needed referral, we have referred them to higher centers or asked them to go and show in a tertiary care center. They were then admitted in the hospital for 10 days. They were detoxified using drugs which cause, which have actually what is called as cross tolerance with alcohol, or we were using these nicotine chewing gums, and of course, cannabis does not have any detox agent as such. So these patients were admitted for 10 days, and during this period, we have conducted counseling for them, identified psychiatric comorbidity. In fact, almost half of them had psychiatric comorbidities, including depression, anxiety, bipolar disorder, and grief reaction. These were the common psychiatric comorbidity we found. And of course, alcohol, liver disease, diabetes, hypertension, pancreatitis. These were the medical comorbidities which were observed in these patients who were admitted for 10 days. So today we completed the 10-day period. In fact, we are very grateful to the district administration led by our Deputy Commissioner Kurmara, who himself inaugurated our camp on the first day. And we are also grateful to the Disabled Welfare Officer, whose department is sponsoring this program along with AV Baliga Charities and Kamal Baliga Charitable Trust. So the basic thing is these sort of community awareness camps create awareness about alcohol, tobacco, ganja. They very clearly help us to identify the addicts who want treatment. In fact, we do not take anybody on, what do you say, forcibly. They have to get admitted on their own, and they will have to stay voluntarily in the hospital. So this is a new model which we have proposed, and I'm sure many more hospitals would follow this model. This is a hospital-based camp, and definitely we have ended successfully. And I expect, and we will be following up these patients for a period of 1 year. We have already given them dates when they will be followed up and all. So basically, this is an effort to tell that this drug addiction is a disease. It is not habit. This is a disease, and it needs to be treated by doctors. We were in our team. There are four psychiatrists, 12 psychologists and social workers, and five nurses, and eight nursing students, and three ex-alcoholic volunteers. And of course, every day evening there was this Alcoholic Anonymous meeting, and then every day night there were bhajans. So early morning started with exercise and yoga. So we were planning to inculcate a daily routine in these people, and then of course there were lectures by psychiatrists, psychologists, social workers on various aspects like alcohol as a disease, side effects of adverse effects of tobacco, adverse effects of ganja, adverse effects of drug abuse, relapse prevention, methods of reducing craving. These were the certain things which were discussed. So after that, every day evening they would attend the Alcoholic Anonymous meetings. So this is the whole concept as such. So I'm sure I'll be live streaming videos like this in future also. This was just a trial video. I request all of you to stay tuned in to this channel. I am Dr. P.V. Bandari, psychiatrist. I work for not-for-profit organization called A.V. Baliga Charities Mumbai. I am the medical director of A.V. Baliga Memorial Hospital, Udupi. We run a home for aged. We also run a home, long stay home for psychiatric inpatients, and we also run a 70-bedded hospital, and we also have a rural medical center run under the concept of Pura, that is providing urban facilities in rural areas, which was propagated by our late president, Sri Abdul Kalam, the Rashtrapati of India. So we will be broadcasting things of importance, things that take place in our hospital, or things of public importance. This is my personal channel, and I request you to subscribe to this channel. Thank you. ಏನು